Hello, my friends, family, esteemed colleagues. Recently, I wrote an article about adenomyosis and endometriosis. And this is actually a very good topic to explain what we call disease and how come that the same type of toxicity will cause two different so-called diseases. Now, I don't call anybody patient. I call people that work with me clients, because I help them and they help me. So it's kind of mutual cooperation. So when I say that diseases do not exist, this is why we don't have patients, because nobody is sick. What we have toxic bodies. And same type of a toxicity may cause so-called two different diseases, as is here a question with adenomyosis and endometriosis. Now, what are those diseases, those two mentioned? We are talking about problem with women sexual organs, which are covered with endometrium. This is the tissue. This is a membrane. And that basically surrounds uterus. And now, same toxic blood in some women may cause that the endometrium starts increasing in size, because, proliferating probably is not the right point, like inflaming itself. Now, what does endometrium serve for? Well, endometrium is basically protecting uterus, and we have it within and outside of uterus. And when in the case of endometriosis, the outer endometrium starts thickening more than usual, and it may start forming increased pockets. The thickening may not be everywhere, just in areas, and it's usually superficial. So it can actually be also on the ovaries. Now, in adenomyosis, it is more going within into the muscle. Now, if we are talking about the same toxins, why do they in some women affect the outer layers, and in some women they go within, penetrating into the muscle tissue? I explained that female organs are very active during childbearing age. This is why both of these two diseases occur only in women of childbearing age, and usually not in the early age. Well, lately, yes, but before it was women over 30, between 30 and 50, just before menopause, and after menopause, this goes away. So if toxic blood is causing it, how come that only basically in that period of time? And what happens after menopause? So doctors go immediately, it's a hormonal change, and pow, it's hormones, hormones, hormones. Well, hormonal change is also a reaction to the environment. Same as the body reacts to the environment, which is blood and lymph in that case. Since organs that are involved in procreation have to be maintained ready, so a female body has a system of basically cleansing those organs separately. And every month, through menstruation, eliminates not only toxins from this area, but if blood is toxic, it is going to try to also eliminate more blood. But what do we see in adenomyosis and endometriosis? That the bleeding can be profound and for a long time. Why? Well, because for those two so-called diseases to occur, the blood has to be very toxic, and there has to be already change in a tissue, in endometrium, created by toxic blood. And very often, why do we have tumors growing in uterus? Well, because, or cysts, because this is how the organs are being protected with additional protection by forming storages where the toxic blood will go first through those, discharge some of the toxicity there, and then cleaner blood will go further into uterus, into ovaries. So if we have toxic blood, if a woman has toxic blood, she is going to have cysts and tumor growing after a while. And cysts always will grow and be the biggest just before menstruation, and after menstruation they kind of decrease, because through menstruation it's an outlet to get rid of some of these toxins. And this is why woman is going to bleed stronger and longer, because body is going to try to use this opportunity to cleanse. Now, why in some women we have adenomyosis, which means it stays on superficial endometrium, and why in some women we go into endometriosis, which are actually opposite. Why in endometrium is on the outside and adenomyosis goes into actual muscle. So from endometrium goes into the muscle, because the symptoms are basically same. There is a pain, heaviness in the stomach, in area of uterus, and painful menstruation, could be with a lot of bleeding, cramping. This is all symptom of toxicity. But there is one difference why in some women we see these changes of a tissue that accumulates toxins. This is why it may even have small cysts in it, has spaces where blood fills in, because this is where some of the toxicity is being trapped. And why this happens during endometriosis, happens in the endometrium, mostly on the outside, and in adenomyosis is penetrating from endometrium into the muscle tissue. Where, when do we see endometriosis, and when do we see adenomyosis? Endometriosis we see in women that do not have children, and actually all these changes also cause shrinkage of the ducts, so the eggs cannot pass. And it makes it very difficult for a woman to become pregnant. This we are going to, here we are also going to see cysts, but cysts we can see also with adenomyosis. But in adenomyosis, it's not so much the outside endometrium, but it's in the inner part that penetrates and starts growing into integrating in muscle tissue. It doesn't really integrate, but actual muscle tissue start developing also these cysts and these bubbles of stored toxins. So the illusion is like the endometrium is growing in. It's really not the case. So the women with adenomyosis, they have been pregnant. They may have child, and actually after birth can even have stronger problems with this. So this is the one difference in symptoms. The other symptoms are basically the same, but in adenomyosis, women usually have children, and in endometriosis, they don't. Now you can understand how what we call disease is created through areas where more blood circulates. If a woman is not pregnant, the uterus, the muscle tissue, is not really active. All the action is in endometrium, and this is where you see problems because of toxins coming there. And usually when a woman is in childbearing age, this area is very active, goes through regular cleansing every month, and a huge amount of blood goes this way. So if blood is toxic, bingo! And just before menstruation, you have this big accumulation of the toxicity that then becomes released through menstruation, and afterwards everything calms down a little bit. Not much, but a little bit, because it's decrease in toxicity, overall toxicity. Body eliminated pint of toxic blood, like donating blood, and created a fresh blood that is not toxic, so it dilutes overall toxicity of the blood in the body. Now women that are pregnant and also have toxic blood, well, now the muscle tissue, uterus itself, is becoming way more active. There is way more blood going through it, because now supply of blood has to come to the baby, and now more toxic blood penetrates the muscle itself. And this is when the muscle gets affected and has these epithelium-looking tissue that is spongy and full of liquid. It's a toxic liquid. And because muscle is now more active, it basically behaves like storage of toxins, trying to isolate the toxins in the body of the mother and not pushing it towards the baby, which goes, placenta is also one way of defense, but also the muscle tissue becomes another line of defense of uterus. This is same why the breasts become tender, why we have polycystic breasts, which I made a video before about. It's the same thing. Different tissues. Same reason. Same cycle. Everything is the same. We just invent different names because where it is located, what kind of tissue it is. We make science of creating diseases which do not exist. Should just be called toxicity. So here you can see easily how the same culprit in the same organs produces a different disease which doctors don't know how to explain. They have no clue. Just check it out. Ask any doctor, any expert to explain to you why endometriosis or why adenomyosis occur and what causes one, what causes the other. They have no clue. Not a clue. Doctors are so misled that they don't understand single chronic problem. Because if they would understand one, they would get it overall, because it's all the same thing. We have to keep in mind that toxicity is the big problem. And body, because of this reason, has three systems of making sure to keep blood clean. But none of these systems is going to work if we are low on blood plasma, not water, plasma. And you cannot increase blood plasma if you are afraid of salt, because this is where you get your minerals from to create plasma from water. And this is the big joke that Cabal plays on us, because through their scientific expertise and final studies of experts show us how toxic and dangerous it is to have salt in a food, because, you know, hypertension, water retention, inflammation, heart problems. This is all caused by salt, right? It's all caused by a lack of salt. And what do we know about Cabal? Inverts everything. So if you want to know what is the science behind science that doctor will spew, just invert it. And you know where the truth lies. Because everything they indoctrinate us with in universities, medical university, is Rockefeller Foundation version of science, becoming science. If you have these problems, if you have painful menstruations, all you have to do is load up on plasma so your body can cleanse. You don't even have to change diet, just load up on plasma so your body can start hydrating the blood and cleanse the blood. And cleaner the blood is, the less necessity will be in those organs to form additional cleansing stations, and cysts, tumors have no reason anymore to form, so they will actually dissolve. and body heals itself. Because remember always that body is created as a perfect robot, self-maintaining, self-organizing robot. And it constantly adjusts to the environment. It will not support what it doesn't need. Why do you have thick bones? If you're always sitting, or you got skinny, so you're very light. So it will thin the bones. Bones will thin. Try to, look through the pictures of people from concentration camps. Find me one thick-boned individual. They all have the same bones, same size, and skeletal bodies because there is no weight, there is no muscle on them. More weight you gain, the body needs more support, and it starts thickening and reinforcing the bones. Or you start playing high-impact sports, and the bones thicken. Look at knuckles or parts of the hand where martial artists are using to break bricks and ice. The skin becomes hard as a bone. Self-adaptation. But it does it to protect itself. Well, another mystery solved. So open your mind, start thinking differently than you have been told. You have been told, don't think, just repeat what you are being told. Well, it's time to stop this. It's time to re-examine what do we know. And if you have a holes in the knowledge, start filling them up. Thank you for listening. Till next time, love you all. Namaste. God bless.